A very warm welcome to all to the Cancer Care Series talk show, an initiative of Roche supported by the Integrated Health and Wellbeing Council. I am Dr. Asavri Sawant, Public Health Specialist for Team IHW Council, and I will be moderating this show today. 19th April is recognized all around the world as World Liver Day. To spread the necessary awareness on this essential topic of signs, symptoms, and diagnosis of liver cancers on World Liver Day, we have an eminent expert here with us, Dr. Prasanna KS. Dr. Prasanna is the consultant hepatologist at Manipal Hospitals, Bangalore, and has a very large experience in this subject. Dr. Prasanna, we welcome you to the show.
Thank you very much for this talk show, and I'll be very happy to share my experiences for the benefit of the public.
Thank you so much. So let us get started. So let us first talk about what are the incidences of hepatocellular carcinoma or liver cancers in India, how prevalent it is.
I think it's one of the main, say, top 10 cancers that is documented in India, and it's in a rising trend because of the epidemic of diabetes that is rampant in India, with the obesity epidemic that is coming into picture. NASH and diabetes plays a kind of deadly combination in development of hepatocellular carcinoma, and it is in the rising trend as of now.
Thank you so much for highlighting that, sir. And we would also like to know that what kind of population is at risk for developing this hepatocellular carcinomas?
So usually the population, the age group is more than 40 years. Less than 40 years developing hepatocellular carcinoma is quite rare. From 40 up to 60 and more than 60 is the common age group when they would develop, because most of these patients would have underlying cirrhosis to develop say cancers. So the development of cirrhosis itself would take some time, with some exceptions, like say in case of hepatitis B, they at an younger age without even having underlying cirrhosis can develop tumors, but that's a rarity. So usually it's somewhere around 50 to 60, I would say, the age group for development of hepatocellular carcinoma.
Okay, so age group of 50 to 60 should be very aware about this and should consult their doctor if they have any sort of signs. So the signs and symptoms we would be talking about next. So can you please touch upon what are the symptoms of liver cancer?
I think it's very difficult to put a simple kind of symptomatology or signs for hepatocellular carcinoma, because liver being a large organ, usually smaller tumors would not have any impact either on the functioning of the liver, so that the liver function deranges, or in terms of symptomatology. So usually only when it becomes big enough, usually they will have symptoms, and usual symptoms would be, say, development of jaundice, or loss of appetite, or loss of weight, and pain, especially in the right upper quadrant of the abdomen. That's where the liver is. Some discomfort or pain usually is what they present with, but most of the times it is picked up as incidentally, like say they go for a routine health checkup, they do an ultrasound, and they find out that there is some tumor in the liver, and then kind of subsequently come to know it's liver cancer. So that's the main problem with liver tumors. Usually they won't have much symptoms, so that's why maybe a routine health checkup is the best way to pick up these tumors, especially the liver tumors.
So most often people associate jaundice with, liver diseases. So in the topic of liver cancer, can jaundice be also one of the signs and symptoms?
I mean, jaundice can be one of the symptom in liver tumors, but then that's not the common presentation, because for somebody with liver tumor to develop jaundice, the tumor has to be quite big, or it is in such a position that it is compressing upon the, say, bile duct, or if it has spread to lymph nodes and then causing problems. So those are rare things. Usually, say, for example, we do see often, say, 10 centimeter liver tumor without any specific symptom picked up on routine ultrasounds. So jaundice is not a common presentation in liver tumors. Usually, as I told, it's incidentally picked up, or maybe at the most it will be due to, say, large tumors stretch of the liver capsule can have some pain and discomfort, and that will be the usual symptom while they present.
Thank you so much, sir, for highlighting that. So, while early detection is the best method for avoiding any sort of disease, how can, in your experience, we can avoid liver cancers and prevent them from early on?
So prevention might not be very much possible in liver tumors because, as I told, say for example, if diabetes and cirrhosis is a potential combination for development of liver tumors, hepatitis B is again one of the main cause, hepatitis C is one of the main cause for development of tumors. So to prevent hepatitis B and C will be a way of preventing hepatitis, I mean, in the liver cancers itself. So prevention of hepatitis B can be done through vaccination, and prevention of hepatitis C through maybe screening, routine screening and treatment. Those things will prevent development of cirrhosis and subsequently tumors. But if when it comes to say cirrhosis due to other causes or cirrhosis in diabetics, the prevention would be more like to pick up the tumors at an early period so that we can potentially cure those tumors. So any cirrhosis, the indication or the guideline and the practice is every 6 months we would do ultrasound abdomen and alpha fetoprotein level. That's the tumor marker for liver cancers, and to make sure that we pick up at the earliest possible time so that we can cure it at the early, so that it doesn't become life-threatening problem in future. I think there are two parts to it: preventive in terms of few of the things can be prevented, and to pick up at early period so that we can treat it better. So these are the two approaches that we follow.
Thank you so much, sir. So, highlighting more on the aspect that you shared, that to pick up early as possible. So, can you please touch upon and elaborate how is liver cancer detected? What are the detection methods that are available?
So there are two ways of detecting say liver cancers. As I told, we usually check for tumor markers, that is alpha fetoprotein, AFP. But the problem with it is around 50 to 60% of tumors only will produce that alpha fetoprotein tumor marker. Rest 40% might not produce that tumor marker specifically. So in those cases, it becomes difficult to pick up. So the second part to it is imaging. Imaging is commonest is ultrasound abdomen, so that if it is done by an expert on a routine basis in a specific place, they can pick up smaller tumors. But the best way to kind of confirm would be to do imaging like CT scan of the abdomen or MRI of the abdomen. That's like specific triple phase CT and triple phase MRI, because these tumors can be confirmed with imaging itself. We don't have to do biopsies like in all other tumors. We don't have to really do biopsy. Just a triple phase CT or triple phase MRI will be good enough to confirm hepatocellular carcinoma, that's the liver cancer. And along with that, if AFP is right, that's kind of one more added thing to diagnose this thing. Rarely in those cases where there is a lot of dilemma as to whether it is tumor or not, these things are not like really kind of adding up to, then we might end up doing a biopsy, but that's a rarity. That's not routine practice.
Thank you so much, sir, for highlighting all those various methods. So, as our audience is from mixed background, from both medical and non-medical field, so can you please explain what is liver biopsy? What does it mean, and when would that be required?
Any biopsy means taking say a bite from the tissue wherever whichever we are targeting. So in liver biopsy, it will be part of the liver tissue that we will take. Usually this procedure is done by putting a needle into the liver and then taking the part of it and then kind of checking it under the microscope. If it is kind of to be done for tumor, probably it should be done through a guidance like say ultrasound or CT guided, where we target that specific lesion, take a sample from that specific tumor and then check it for whether this is tumor or not. So as I told, 90% to 95% of the times we would not require a biopsy in hepatocellular carcinoma to prove whether this is tumor or not. Imaging itself and blood test would be good enough. Rarely when the imaging doesn't add up to or doesn't confirm this, or if the tumor markers are like borderline, and if we have to decide as to what is to be done for that specific lesion, then we might end up doing a liver biopsy, which as I told is a rarity. Or if say for example other situation where we might end up doing liver biopsy for a liver tumor is if it is secondary. Secondary means, say the tumor is in, say, colon, intestine, and this spreads to liver. That's a common site for colonic tumor to spread. So if it has spread to, say, liver, and we are not sure whether it is a primary tumor of the liver or it is primary tumor of the, say, colon spread there, or if you have to confirm that there is metastasis, because the treatment would radically differ in that case, then we might end up doing a biopsy of that lesion to make sure that confirm the diagnosis. I mean, these are the two set of indications where we would do a liver biopsy.
Thank you so much, sir, for very elaborating explaining that. Let us also move on to understanding, are fatty liver diseases and liver cancers related? So can you please explain us?
Yes, all fatty liver would not develop cancer. That's something which will be overdue, because almost around 30-40% of the population, general population, would have fatty liver. But if somebody has got fatty liver along with multiple risk factors, like, say, for example, if somebody is obese, somebody is diabetic, has got fatty liver, then the chances of them developing liver cirrhosis in future and then developing a tumor is quite high compared to somebody who has got just fatty liver and no other complications as such. So yes, it is a risk factor for development of liver cancer, but it's not a common thing. It's not a common thing. If say 100 people today develop fatty liver, then maybe one or two might develop in future cancer. It's not that most of them would develop.
Thank you so much. Also, can you please highlight how important is early diagnosis and early detection?
I think it's very, very important. That's the most important thing for any cancer, for that matter, because if you pick up early, that you will get the best treatment and it's curative. Say, I would make a point in a simple way. See, any cancer treatment, there are two ways to treat it. I mean, either it will be palliative or curative. Curative is that you completely take care of the tumor and it's gone out of your body and you do well, have a normal lifespan. Palliative is just to alleviate the symptoms and signs and then kind of try to prolong it as much as possible. If you want a curative treatment, you have to detect it early at an early stage. If it's detected at a later stage, you'll end up getting palliative care. So that's the importance of picking it early in the stage.
Thank you so much. So, while picking it up at early stages is very important, which blood tests are done to diagnose liver cancer for our population who, are not very much aware, for spreading awareness?
I would say in general population, we don't really target to pick up or do routine screening for liver cancers. That's not at least the practice as of now, because it's not so common in the general population unless they have some risk factors. But yes, if somebody wants to do it, alpha fetoprotein and a routine ultrasound abdomen on a yearly basis, if they're doing, say, checkup, that would be good enough. As I told, more than 40 years is when usually they would develop. So more than 40 years of age.
Let us now move on to discussing about the treatment options that are available in India for liver cancers. So can you explain us if the liver cancers treatment option is same as other cancers, or do they vary?
As a hepatologist, I would say it's entirely a different kind of an approach that one should have for liver cancers. Because it is not in the sense like, say, any tumor oncologist manages in most of the scenarios. If you diagnose a cancer, you send to oncologist. That's what the normal phenomenon would be. But liver cancer specifically is a bit different in a way, because it requires multidisciplinary approach. Because say if you pick up a tumor in a normal liver or a, say, compensated cirrhosis, you can a small tumor, you can do a resection. Say part of the liver can be removed safely and the liver will regenerate. So that's a surgical approach. So you need a liver transplant group where there is a liver surgeon who does it routinely. So that's one person that's to be involved. Hepatologist is important in this, because if there is anything to be done, there are chances, because most of these patients will have cirrhosis, so they might end up with decompensation that requires close monitoring and management of liver disease. So hepatologist has to be involved in most of these cases. You require a radiotherapy person because if there are certain tumors, large enough tumors or even smaller tumors nowadays, we can do SBRT for portal vein thrombosis, tumor thrombus and all those things. So a radiotherapy doctor is also involved. In many cases, we would do interventional radiology procedures like TACE, TARE, we would do radio frequency ablation, microwave ablation. So all those things are done by interventional radiologist, though under the care of hepatologist, because again, post procedure we need to manage, pre procedure maybe we'll have to optimize the patient. So it's, and then of course last chemotherapy and immunotherapy also has come up. I mean, chemotherapy mostly not much as such compared to other cancers, but then there are few options available, and immunotherapy the latest that is available. With all these wider options available, I think it's always good if it is managed by a hepatologist, because there is underlying liver cirrhosis, than managed by oncologist like in any other case, because it requires specific treatment as per the individual, it on the individual case to case basis. It's not an umbrella therapy that would suit everybody. So that way I would say it is much different compared to any other tumors.
So many people do not understand what is the meaning of chemotherapy and targeted therapy or localized therapy. So one by one, can you please explain us what that means and what does that entail in a usual treatment for liver cancer? So starting with surgery and localized treatments.
Oh, fine. So I would again split it into rather into kind of specific into curative and say palliative options. Okay,
Yes.
curative options are, say, if the liver, underlying liver is normal and there is one single tumor which can be removed safely, that is resection, we would say. Part of the liver, that part of the liver would be removed and the liver would regenerate. So that becomes resection. That's the surgical option. The second is according to, say, if it falls in certain category, if the tumor is say less than 5, 6, or 7.5 centimeter, we can offer them liver transplant. So that's again a surgical option. So these two are curative options. If you come to local therapy, again, microwave ablation and radio frequency ablation, both are methods where we would burn those tumors. If the tumors are less than 3 centimeter in size, uh, then this again is a curative option where we can burn the tumor. We would insert a needle into that tumor and surrounding area can be burned so that rest of the liver is normal. And then this again is a curative treatment option where the results are quite good. Then comes the palliative treatment options, the next set of treatments, that is TACE, that is trans-arterial chemoembolization. In the sense, every liver tumor, or for that matter any tumor, will have a specific blood supply. There's an artery supplying that tumor, and in this TACE, that is trans-arterial chemoembolization, and the other thing TARE, that is trans-arterial radioembolization. In both things, we would block that specific artery feeding the tumor selectively and then inject either radiotherapy, radiation, or chemotherapy medicines into that tumor so that that tumor is taken care of. So in this case, again, TACE or TARE, there are subtle kind of things that we would look into as to which one is better. But then usually TACE and TARE are good options, but then they're palliative in the sense it will kind of prolong the whole process. It might not cure, except for certain situations where the tumor is, say, borderline, like as I told, 7 centimeter, we can do transplant. Say it is 7.58 centimeter, then we can give a radio TACE or TARE and then reduce the size of the tumor. If it significantly reduces, we can offer them transplant again. So there's kinds of situations. And then chemotherapy comes into picture when palliative care comes into picture. So if we are doing TACE or TARE, along with that, or if TACE and TARE is not possible, then we can give chemotherapy. Chemotherapy, there are multiple drugs available, but again, this has not found to be very effective in liver tumors. It marginally improves their survival, say around by 6 to 12 months, not beyond that. And it has got its own limitations in terms of side effects and all those things. And the last and the latest is the immunotherapy, where we give medications like chemotherapy, IV injections, and then This again is used only in advanced tumors where no other treatment options are available, so that if we can give them a chance as to if there is anything that is positive that comes out of it. It again prolongs the whole survival by around 18 to 20 months, and in certain cases around 10-12% of patients it can give better responses. So that's where the whole gamut of this treatment options that are available for these patients.
Thank you so much, sir, for so elaborately explaining us all the different options available. So, as many people are not aware about liver transplants and their success, so can you please talk about how successful are liver transplants, and how to reduce that sort of hesitation that people have if somebody is prescribed liver transplant and should go for it.
So I would say the one of the best indication for a hepatologist and even for the liver transplant surgeon to do a liver transplant would be hepatocellular carcinoma, that's liver cancer. Because usually those patients will be well compensated. They'll not be very sick or something. They would have incidentally picked up a tumor, and then if it is within criteria, as I told, around 6.5 centimeter or less than that, that's when we would offer them liver transplant. And the success rates are quite good. Say 5-year survival will be somewhere around 70% in these patients. That's quite good compared to any other tumors. So if they do well, uh, they would have a normal long-term lifespan. So that's the best part of it. Uh, it's not something. I mean, if it is done in a high volume center where it is done routinely, then the outcomes are quite good, and they will have normal lifespan. So they wouldn't really have to go through any major problems as such. Because usually if the liver transplant is done for hepatocellular carcinoma, usually they will get discharged in say 15-20 days time, and usually do very well. They wouldn't really have much of problems as such. So I would not really hesitate to at least offer, and patients also should not feel much kind of worried about getting a transplant done for liver cancers, because that's the best treatment option actually available, because you're getting rid of the whole source of liver tumors itself. That's the cirrhotic liver. So I would say it's very good option as such.
Thank you so much, sir, for throwing light on that. Because many people believe that liver transplant is the last option available, and when nothing works, then doctors prescribe them liver transplant. So there is so much necessary awareness that is required on this topic, so that people who are advised to go through such treatments are not hesitant, are open to their doctors, and can communicate freely all their fears and get rid of misconceptions. So, what would be your advice on the World Liver Day today to all the audience that is watching us?
Okay, I would not really kind of talk or advise regarding liver transplant as such on World Liver Day. I would rather say
On
uh,
Sir Liver
two,
Health.
yeah, two specific things I would say. One, I think hepatitis B and hepatitis C are something which goes unnoticed. It's asymptomatic. Say the prevalence is around 1.5 to 2% in India. So it's quite big number that way compared when you take the numbers or the sheer population that we have. So it's very important whenever you get an opportunity to get screened for hepatitis B and C, so that you pick it up at early stage. And for hepatitis C, there are very good treatment options available, and for hepatitis B, we can keep track of that so that they don't develop tumor surprising at some age, say at 40-50, getting tumors right away. So that's first thing I would say. Everybody, whenever you get a blood test, and just get checked for hepatitis B and C, and get vaccinated for hepatitis B if not done already. That's first. The second thing is the epidemic of obesity, overweight, and diabetes is something which is uh, creating more trouble in terms of liver, say fatty liver cirrhosis, and liver tumors. So I would say eat healthy, and then have a kind of active physical life, in the sense uh, be physically active to make sure that you don't end up with any of these things. I think these are the two things. If you do right, your liver should be healthy. I don't think you would end up with anything like liver cancer.
Thank you so much, sir, for taking out your time from your busy schedule and sharing with us the wealth of knowledge and information on the topic of signs, symptoms, and diagnosis of liver cancers. Thank you so much. We would also like to thank Roche for this initiative on spreading awareness on liver cancers on the World Liver Day today. So, thank you so much. We would also like to thank all our viewers for staying with us till the very end. I hope this session was just as insightful to you as it was for us. So, thank you all once again. With that, we will close this session off. I wish you all a very happy day. Thank you.